Are you getting enough deep sleep? Let's find out how you can tell. There are lots of myths and misconceptions about the different stages of sleep. In this video, we are going to be talking about the stage of deep sleep. If you're interested in learning about sleep and mental health, then go ahead and subscribe to this channel where we talk about science-based strategies to optimize your sleep and mental well-being. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. Every video also contains a tip for healthcare professionals. If you are a physician or a healthcare professional, then I'd like to invite you to get my free clinical sleep mini course, which is jam-packed with great, useful, practical, high-yield information that you can use in your clinical practice to help your patients optimize their sleep. The link to the mini course is shown on the screen here and is also available under this video. This is the third in a 4-part series on sleep fundamentals. So after this, if you haven't seen the first 2 videos yet, you can go ahead and check them out after this video. What is deep sleep? Deep sleep is known as slow wave sleep. It's also known as N3 or stage 3 sleep. And the reason it's called slow wave sleep is because on the EEG, on the brainwave recording that you see during a sleep study, you'll see these really big, beautiful delta waves on the EEG. Those delta waves are known as slow waves. And what happens during deep sleep is quite a few things. One, it's really important for restoration and repair. You get increased blood flow to your muscles. You get growth and repair of bones and other tissues in the body. You get repair of your cells in the body. Your immune system is strengthened and regulated. Deep sleep is also really important for consolidation of memories. And this stage of sleep is often referred to as sleep-dependent memory processing. You also get hormone release like growth hormone during deep sleep. And during deep sleep, your brain is also able to flush out toxins that build up during the day. There's one particular one called beta amyloid that is implicated in development of Alzheimer's dementia. And during deep sleep, your brain waves synchronize and you get this pulsatile flow of these toxins out of your brain through the glymphatic system. So deep sleep is really important for all of these functions, clearing out toxins, restoration and repair, and consolidation of memories. So when does deep sleep happen? As I mentioned, it's also known as stage 3 or N3 sleep. So when you're transitioning from being awake to being asleep, you go into N1 sleep. Then you transition into N2 or stage 2 sleep. Stage 2 sleep comprises most of your sleep across the night, and you go through these different stages in cycles. After N2 sleep, you go into N3 or deep slow wave sleep. And this is usually about 20 to 30 minutes after falling asleep. After about 70 or 80 minutes of deep sleep, then you transition into a lighter stage, and then you start going into REM sleep. And so these different stages of sleep cycle across the night on approximately a 90 to 120 minute cycle. We usually get more deep sleep in the first half of the night, and then as we go into the second half of the night, we usually get more REM sleep at that time. If this type of information is helpful for you, then go ahead and click the like button. All in all, how much deep sleep are you supposed to be getting? So we just talked about these different stages of sleep. Stage 1 is approximately 5% of your sleep. Stage 2, as I mentioned, is most of your sleep. That's about 50% of your sleep. Stage 3, deep sleep, is about 20% of your overall sleep architecture. And then stage REM sleep, or rapid eye movement sleep, comprises about 25% of your total sleep architecture. So what happens if you're not getting your 20% of deep sleep? This may be related to certain conditions like depression that can reduce the amount of deep sleep that you're getting. So it's important to address any underlying conditions like that. Also, certain sleep disorders can disrupt your sleep architecture. So circadian rhythm disorders, sleep-related breathing disorders like sleep apnea, periodic limb movement disorder, which happens when you're sleeping. All of these can reduce your deep sleep by causing sleep disruption. So again, you want to make sure you're addressing any of those underlying causes. Sleep deprivation is a common one. About a third of adults are sleep deprived, according to the CDC. So you want to make sure that you are getting good quality, adequate sleep on a regular basis, that you're making sleep a priority. If you're not making sleep a priority, you're not going to allow yourself to get all of those stages of sleep that are so important for restoration. If you're not getting enough deep sleep, it can lead to other conditions like Alzheimer's dementia. As I mentioned, deep sleep is the time where your brain is able to flush out all of those toxins. A lack of deep sleep can increase your risk of high blood pressure, It can increase your risk of heart attack and stroke, and also your risk of type 2 diabetes. Now, if you use any kind of a wearable, like I use an Oura Ring to track sleep and some other variables, it will tell you how much deep sleep you got, how much REM sleep you got in various percentages. Take that information with a grain of salt. These wearables are great at tracking certain things. I find it really useful for tracking your sleep patterns, your time that you're sleeping. It's a great reminder to go to bed, especially if you're a bit of a person who delays bedtime or a bedtime procrastinator like myself, so that can be a really helpful reminder. But the actual sleep staging is not very accurate yet with wearables. You can't really get a great sense of sleep staging without doing an actual EEG or brainwave scan. So you can use your wearables for tracking your total sleep time, your sleep patterns, your heart rate variability, your body temperature, and your pulse, and all those kinds of things. But it's not great at tracking your sleep staging. So don't rely too much on that data. Okay, so how do you make sure you're gonna get enough deep sleep on a regular basis? One is to make sleep a priority. Make sure you're going to bed on time. As I said, remember that most of your deep sleep happens in the earlier half of the night. So if you're staying up too late, then you're not allowing yourself that opportunity to get that good quality, deep, restorative, flow wave sleep. So make sure you're going to bed on time. Make sure you're keeping a regular sleep schedule so your sleep architecture can stay on track from night to night. Make sure you're eating a good diet. There is some emerging research suggesting that diets that are high in fiber help to promote good deep sleep, and that diets that are high in processed sugars and saturated fats can actually have a negative impact on your sleep quality and your deep sleep. There's some research showing that heat can actually help promote deep sleep. So sitting in a sauna or a hot tub can be helpful. And if you don't have access to those things, you can take a warm shower or warm bath before bed. Avoid sleep disruptors before bed. You don't want to be disrupting your sleep architecture with things like caffeine. Caffeine has a half-life of about 6 hours, which means that if you have a cup of coffee at noon, 6 hours later, half of that is going to still be in your system, and then 6 hours after that, so at midnight, a quarter of that is still going to be in your system, and that can cause some sleep disruption. Alcohol, of course, also is a sleep disruptor. Exercise, of course, is great for sleep quality and can help you get deep sleep. Here is your tip for healthcare professionals. Certain medications can affect sleep architecture, and it's really important to be aware of these because you may be seeing patients who are experiencing sleep issues, and it could be from the medications that they're being prescribed. Certain antidepressants like SSRIs, MAOIs, tricyclics can reduce REM sleep and also increase REM latency. Pain medications like opioids can reduce deep sleep. At higher doses, they can also reduce REM sleep. And if you have patients on opioids, you always want to be on the lookout for central sleep apnea. And if you have patients taking NSAIDs, NSAIDs may impair sleep by inhibiting prostaglandin synthesis, which is thought to be important for sleep. And then be on the lookout for your patients taking beta blockers, because beta blockers can suppress the body's production of melatonin via inhibition of adrenergic beta-1 receptors. So sometimes exogenous supplementation with melatonin can be useful in patients who are taking beta blockers. Okay, so healthcare practitioners, don't forget to assess the role of prescription medications on your patient's sleep quality. What was your biggest takeaway from this video? Let me know in the comments.